Of kids across California approved for at-home nursing care. Some say they are struggling to get the help that they desperately need.
It's a problem that Team 10 has been reporting on for more than a year, and Team 10 investigator Adam Rakusin discovered that that fight is now turning to the legal system.
Yeah, there's now a federal class action lawsuit that's been filed against the state agency. The lawsuit claims the state has failed to hold up its end of the bargain to provide kids that have been approved for help with sufficient in-home nursing services to keep them at home and keep them safe.
Paralyzed from the shoulders down, Riley Phipps needs round-the-clock nursing help. His family has Medi-Cal and say they've been told to expect at least 16 hours of approved at-home nursing care a day.
We can't get any hours because there's no nurses available to fill those hours that we're approved for.
This is Julian. He's also approved for at-home nursing care through Medi-Cal. In 2017, when Team 10 interviewed his mom, Julian was approved for 22 hours a day, 7 days a week.
Right now, we get about 8 of that.
Somebody should be here helping you all but 2 hours of the day.
That's correct.
7 days a week.
That's correct.
And right now, they can only cover 8 hours a day?
That's correct.
According to the group Disability Rights California, thousands of kids across the state have been approved for in-home nursing care, but can't get all the services they need. The nonprofit, along with several other groups, filed this class action lawsuit on behalf of 2 unnamed families against the California Department of Health Care Services and its director. It asks that the state take all steps necessary to arrange for previously approved medically necessary in-home shift nursing services.
We have a whole lot of kids who are really in need. They've been approved for this type of care, but that care is not being provided to them.
San Diego Assembly member Brian Mainshine tried to get the problem fixed through legislation.
We did a bill on this. The bill got really a great reception. We were able to get it into the state of California budget, got a huge increase in funding for the first time. All these are huge successes, and then you find out that they're still not following through on the promise that they made.
Health advocates say part of the problem, there's not enough nurses. They say the shortage is because of out-of-date Medi-Cal reimbursement rates. It makes it difficult to recruit nurses with the right skills willing to work for less. Mainshine says they need a pay rate that will help get and keep nurses on the job.
It's too bad that a lawsuit had to be filed, but I think they're right to file it because right now that need is not being met.
And I reached out to the State Department of Health Care Services for a comment on this lawsuit. As of right now, we have not heard back. Adam Rakusin, Team 10.